From our previous discussions regarding the loss of fluids and electrolytes in other ways, you've probably already predicted that there's going to be safety issues that are associated with the acid-base regulation, the loss of electrolytes, and the loss of fluids as one vomits repeatedly. Indeed, as one vomits, the acid is excreted. That's the hydrogen ion. And if that occurs multiple times, the entire body could become too alkaline. And the pH of the system therefore increases. The metabolic alkalosis and dehydration are going to occur. Those types of imbalances can then lead to neurologic symptoms and then spiral out of control very, very quickly. So it's really important to monitor the situation, make sure that the problem has not occurred for a long enough period of time for that type of complication to occur. But there's also safety issues regarding the condition that is causing the vomiting, because in many cases, the underlying condition will need to be treated before the vomiting stops. When we think about vomiting, we normally think, oh, some bacteria, some toxin in the gut. Something down there is causing that feeling. But it isn't always bacteria, and it's not always something down there that's causing the vomiting. For instance, intestinal obstruction, appendicitis, gallstones, and perforated bowel are all digestive system causes of vomiting, and none of those will resolve by medications that relieve vomiting. And it's important to consider other causes beyond the digestive system. One of the important things to remember is that when the levels of glucose, electrolytes, or toxins in the body are altered, that change is perceived at the level of the chemoreceptor trigger zone. The chemoreceptor trigger zone is next to the vomiting center, and it detects chemicals and imbalances and responds by sending a message to the vomiting center to initiate vomiting. For instance, the raised glucose levels in a child who's just developed diabetes type 1 will be perceived at that area, and in turn it'll signal the vomiting center to initiate vomiting. And often the vomiting is the first symptom in this kind of imbalance. The buildup of toxins from kidney failure, any condition of pH abnormalities, and also thyroid problems can all present with vomiting as being one of the first symptoms. And once again, in those instances, the imbalance is perceived at the chemoreceptor trigger zone, and the message to initiate the vomiting is sent to the vomiting center. Let's take a clinical scenario. A 13-year-old boy presents with his father. He's vomited after breakfast the past 2 days and has been off his food for the remainder of the day. What's the best approach? A, give him Pepto-Bismol, or B, smell his breath. And I didn't really expect you to be able to answer this one, but just thinking about it will help you remember a safety issue regarding the presenting complaint of diabetes type 1. In that condition, the child or young adult is going to have very high levels of glucose in their system, and they're going to have very high levels of ketones in their blood as well. The ketones are sweet-smelling, so the person with high levels of ketones will have sweet-smelling, fruity breath and sweet-smelling, fruity urine. Obviously, in this case, the boy would have to undergo a couple of simple blood tests to be diagnosed properly, but you can see how vomiting due to this cause is one of the many instances where the underlying problem is not going to be resolved by resolving the vomiting. Right now, we're going to get a really good clear picture of the 4 pathways to the vomiting center and the medications that are best in each instance.